Heart attacks are one of the leading causes of death worldwide, and many factors can increase the risk of cardiovascular disease, including the use of certain common medications. Whether prescribed or over-the-counter, some drugs can affect blood pressure, heart rate, or increase the likelihood of blood clot formation, all of which can lead to a heart attack. In this article, we'll explore 7 commonly used medications that may pose a hidden threat to your heart health. Recognizing these risks and using medications responsibly is the first step in protecting your heart. 1. NSAIDs, ibuprofen, diclofenac, naproxen. Biological effects. NSAIDs inhibit the enzyme COX-2, reducing the synthesis of prostacyclin, PGI-2, a substance that plays a role in vasodilation and antiplatelet aggregation. This tilts the balance towards thromboxane A2, a substance that causes vasoconstriction and increases platelet aggregation, the risk of thrombosis in the coronary arteries. In addition, NSAIDs increase blood pressure and sodium retention, increasing the burden on the heart. Who is at high risk? People over 65 years old. History of cardiovascular disease, high blood pressure. Smokers, obese, diabetics. Use of high doses of NSAIDs or for 2 weeks. How to reduce the risk? Use the lowest dose, for the shortest time. Avoid combining multiple NSAIDs or using corticosteroids. Prioritize naproxen if required for long-term use, least harmful to the heart in the group. For people with heart disease, use with low-dose aspirin if prescribed by a doctor. 2. Corticosteroids, prednisone, dexamethasone. Biological effects. Corticosteroids cause increased salt and water retention, increased blood pressure. Increased blood sugar, insulin resistance leading to type 2 diabetes. Increased bad cholesterol, LDL, and triglycerides. All of the above factors are classic cardiovascular risk factors. Who is at high risk? People who must use high-dose corticosteroids greater than 5 mg prednisone/day for 3 months. Underlying diseases, lupus, rheumatoid arthritis, severe asthma. Elderly people, with pre-existing lipid disorders. How to reduce the risk? Exercise daily, reduce salt and sugar intake. Monitor blood pressure, blood sugar and lipids every 3 to 6 months. Consider prophylactic statin or metformin if abnormal indices. When possible, reduce dose or switch to other less harmful immunomodulators. 3. Estrogen-containing contraceptives, estrogen-progesterone combination. Biological effects. Estrogen increases synthesis of clotting factors such as fibrinogen, factor 7, 8X. Increases risk of deep vein thrombosis and pulmonary embolism. It can cause endothelial inflammation, increasing risk of atherosclerosis. Who is at high risk? Women over 35 years old, smokers, hypertensive. Factor V Leiden mutation, hypercoagulation. History of venous thrombosis, heart attack, stroke. How to reduce risk? Stop smoking. Screen for blood pressure and cholesterol before use. Switch to progestin-only or non-hormonal methods. Do not use if you have cardiovascular disease. 4. Antipsychotics, olanzapine, clozapine, risperidone. Biological effects. Increase appetite, rapid weight gain. Disturb lipid metabolism, blood sugar, increase risk of metabolic syndrome. May prolong QT serious arrhythmias. Who is at high risk? People with genetic factors of slow metabolism. Already have metabolic syndrome, diabetes, high cholesterol. People using multiple psychiatric drugs. How to reduce the risk? Choose drugs with less metabolic effects, e.g., aripiprazole, ziprasidone. Monitor BMI, lipids, blood glucose, ECG periodically. Early lifestyle intervention, exercise, diet with low sugar fat. Consider using metformin or supportive lipid-lowering drugs. 5. ADHD drugs, methylphenidate, Adderall. Biological effects. Increase dopamine, norepinephrine concentrations stimulate the sympathetic system. Increase heart rate, blood pressure, vasoconstriction can cause myocardial ischemia if the coronary arteries are narrowed. Who is at high risk? Children or adults with congenital heart disease, hypertension. People using high doses or abuse. Have underlying arrhythmias. How to reduce the risk? A heart check before starting the drug, ECG, echocardiogram. Monitor blood pressure and pulse during treatment. Do not use with stimulants, coffee, diet pills, drugs. 6. Thiazolidinediones, rosiglitazone, pioglitazone. Biological effects. A causes water retention, increases pressure on the heart. A causes left heart hypertrophy, can cause congestive heart failure. A rosiglitazone, associated with increased risk of myocardial infarction, MI. Who is at high risk? People with a history of heart failure, uncontrolled hypertension. Over 65 years old, coronary artery disease. How to reduce the risk? Avoid for people with high cardiovascular risk. Choose pioglitazone if necessary, because it is less likely to cause myocardial infarction. Monitor weight, edema, liver enzymes, BNP, if heart failure is suspected. 7. Immunosuppressants, cyclosporin, tacrolimus. Biological effects. A causes renal vasoconstriction and increases salt retention, increases blood pressure. Increases LDL, triglycerides. Can damage vascular endothelium, accelerates atherosclerosis. Who is at high risk? A long-term transplant patients, high drug doses. Pre-existing hypertension or dyslipidemia. How to reduce risk? Strict blood pressure control, below 130/80 mmHg. Use statins or fibrates early if cholesterol is elevated. Regularly monitor creatinine, liver enzymes, blood vessels. Are you taking medication every day? Don't miss this video. There are seemingly harmless drugs that can increase the risk of serious heart attacks. If you are interested in cardiovascular health and want to protect yourself and your family, subscribe today to not miss the most accurate and useful medical information. Click the subscribe button and turn on the notification bell to always update new health videos from the channel.